in terms of limiting expenses that we incur in the healthcare system, there's some easy targets that we could go after. We've seen convictions actually in this area where basically just scammers go out there. They will set up a storefront. They actually hire somebody to ride around in a van, and when they see people in poor neighborhoods walking on the sidewalk, they say, well, how are you feeling today? Oh, you have an ache in your side or something. Why don't you get in the van and let me take you down to the clinic and we'll give you, a free health evaluation. The doctor's in today, and they bring them over there. They see, in many cases, the doctor is fraudulent. He's wearing a doctor's coat, but he's really not a doctor. And in some cases I've seen they actually have medical devices. They run a test, but the medical device is broken. The test is invalid. The patient doesn't see the results. They're told to come back on a different day. And yet these scammers will go ahead and submit claims for valid patient IDs, and they can rack up expenses really $20,000 in a day. I saw one scammer who had been convicted, and they asked him what he did, and he said, well, he liked to submit a claim to Medicare, and he knew the CPT codes, and he said typically what he did was like amputate both arms and both legs and sell them some artificial limbs, and that was about a $40,000 bill.
Yeah, just to make that clear, the actual hands and legs were not cut off. This was just the billing.
That's right. The person never lost a limb. They were perfectly healthy and didn't need that. They just coded the form up and submitted the bill.
Well, going into the nursing home too, on a personal basis, since I know a few nurses, is to where you have patients that have died for a couple of years and they're still being billed back to the Medicare system or Medicaid system, even worse case. And then these are the same people that are paying professional writers on web blogs and postings and emails to talk bad about Medicare and the government trying to cut fraud out of the system. It's interesting you brought on the fact about the vans picking up people to send them out to Mexico, because rather than treating them, now we've got vans picking up people trying to treat them fraudulently. So we're looking at that line. And last weekend when I was going to visit my mother's grave on Alameda in Houston, I saw two guys with signs saying, come on into the clinic, we'll fix you up. So your point is well right on the money, to where these clinics are making money by being scammers. And I hate to pick on foreign doctors. There was a doctor in Louisiana that went to jail for $15 million, folks. $15 million, not the $20,000 or $40,000 per. $15 million. She was not giving the cancer patients the medication. She was billing for it and watering it down and giving it to the cancer patients or selling it on the open market. These are the same people that are telling you that we have the best system in the world. It does not need fraud investigation. One of the points that Rich and I talk in personal basis is allowing the government to come in and audit beforehand to make sure that these doctors are right. It's not an imposition on freedom of speech. It's not our First Amendment right issues. This is a license that's issued by the state, and the federal government should have the ability to audit that doctor. And the ones that are legitimate, I'll throw in a plug for where I go. Memorial Clinical Associates in Houston are one of the best systems that I've ever seen. They're profitable. They run their own PPO. Those are the ones we want to flourish. The ones we want to let go and get rid of out of the systems are these Nigerian-owned businesses and stuff, and doctors, as Rich talked about, fraudulent doctors, that they're not even doctors. The government should be able to, go out and audit them. The state should be able to go out and audit it.
Yeah, the way the system works now is really a trust-based system between Medicare and the providers, and it seemed to work back in the 60s and the 70s. I think it works less and less today. But the system said you could start a healthcare organization and begin to bill Medicare, and the government had 90 days to go out and survey your place of business. A lot of the scammers will set up in a strip mall and begin to bill the government. The government's required to pay the bill within 30 days, but they know they're not going to be investigated for at least 90, and normally it takes a little bit longer than that. So they have about a 3-month window that they can bill millions of dollars. The simple solution to that would be to say, for Medicare, to say you cannot submit a bill until we have audited your business, and you cut out millions and millions of dollars worth of fraud. A basic accountant with 2 years of experience in the business should be able to figure that out.
Okay. We're going to stop here for a second and kind of recoup what we've talked about, and then we'll move into what is Obamacare anyways, and really talk about that. Please remember, we founded the Centrist Foundation without any hidden agenda. Neither one of us really is looking for political office. We don't look for contributions. We pay our own bills, and we set up the JustStreetSense.com, and we provide you with financial advice columns, and we talked about economics, and politics is one part of it. Our goal is to tap into the centrist emotions that are going on in this country, where everybody's kind of tired of the extremism. In fact, there was a story run today to where it's the lowest popularity rating for President Obama and also the Republican Party, and all the extremism that goes on both sides of the equation. So please visit us at www.juststreetsense.com or Centrist Foundation. If you Google it, Just Street Sense, you will find us as top of the rating, we hope. We're going to get started in what is Obamacare in the next segment, in the next file, so please visit YouTube and look for that, or also you can come back to our website and get the link from us. Thank you for listening to us. To summarize, we've talked about scammers and how getting rid of the scammers will save 10 to 15% in the system, where negotiating pricing with drug companies, we think will save 10 to 15%. So if you start adding up the stuff that's low-hanging fruit, how to reduce the cost, and getting rid of the scamming patients. We talked about scammers who are billing, but also scamming patients and million-dollar patients, and be rational about doling out the health care. We will find that we really can knock off 30 to 45%. Okay, when you look at $70-80 billion or more in cost, knocking off 30 to 40 billion is a big cost for a state. The size of the state of Texas, that's about 10 to 15% of his budget. So let's look at things reasonably. Let's get rid of the professionally paid bloggers. Let's get rid of the marketing agents. Let's get rid of the lobbyists nonsense that's out there. Let's look at from a factual, objective view. You can see we have a very good healthcare system. We need to get rid of the scammers. We need to get rid of the fraud on both sides of the equation, meaning the provider and the patient. Okay, and we're going to jump into Obamacare in our next segment. Thank you. Have a great day.